At CHI St. Vincent, we prioritize your well-being not only during surgery, but also in the crucial period afterward. Let us guide you through what you should expect after surgery. After your surgery, you will be in the Post-Anesthesia Care Unit, or PACU. Our caring staff will closely monitor your condition. They'll ensure your comfort, help manage any pain, and address any post-operative concerns. You may also have some dietary restrictions following surgery. Those will be explained to you, and normal food and liquids will be reintroduced to your diet per your medical team's instructions. Our goal is to support your recovery and help you regain strength and mobility. We'll work closely with you to ensure a smooth healing process and provide education on self-care and pain management. Your surgeon will ultimately approve all care provided, decide when you are ready to be discharged, and if you require any home care services. For outpatient surgeries, you'll typically be discharged from the hospital on the same day as your procedure. Before leaving, our medical team will ensure that you're stable, provide clear post-operative instructions, and may give you instructions regarding scheduling any necessary follow-up appointments. At CHI St. Vincent, we want to make sure your recovery is as comfortable as possible. Other ways to manage pain include walking, sitting in a chair, working with a physical therapist, and other distraction and relaxation techniques such as watching a movie, listening to music, etc. You are an important part of the medical process. Do not hesitate to write down your questions and ask them to the medical team. All personnel should identify themselves. If they do not, ask. Before any testing and administration of medications, your identity should be confirmed. In most cases, you are ready for discharge when your vital signs are stable, including blood pressure, heart rate, and temperature. Your pain is at a manageable level, you are able to eat a normal diet, your bowel function has returned to normal, you are able to get in and out of bed with minimal assistance. Your physician and medical team will determine if you need any follow-up care. Other things to consider. Ask your physician if you will be on a special diet. Call your doctor's office the day after you get home to schedule a follow-up appointment if not scheduled at the time of your discharge. Remember, you will not be able to drive yourself home from the hospital. Please arrange your transportation in advance. Once you return home, you will have some instructions to assist you in your continued recovery. No heavy lifting, a 10-pound limit, for 6 weeks or until instructed by your surgeon. Walking. Early mobilization is essential for best patient outcomes and will help you regain your energy level following surgery. Climbing stairs is allowed. No gym workouts, only walking until cleared by your surgeon. No driving until cleared by your surgeon. If you are allowed to shower, pat the surgical area dry. No baths or no swimming until cleared by your surgeon. Call your surgeon's office if you experience any of the following symptoms: fever of 100 degrees Fahrenheit or greater, nausea and/or vomiting, worsening pain, diarrhea with abdominal cramps, constipation, or pain or drainage or redness from around your incisions. Commonly asked questions. Can I shower? You will be able to shower in the hospital and after you go home. Ask your doctor about specific steps to protect your incision site. Do not take a bath or go swimming until your doctor says it's okay. Will I have pain when I am home? The length of time each person has pain or discomfort varies. Some people may have soreness or tightness at their incisions or muscle aches for longer periods of time. This does not mean that something is wrong. Follow the guidelines below to manage your pain. Take your pain medications as directed and as needed. Call your doctor if the medication prescribed for you doesn't relieve your pain. Don't drive or drink alcohol while you're taking prescription medication. Working hard to increase your activity is the best way to help manage your pain in the long term. Follow your physician's instructions for medicines and non-medicine pain management. If you have any questions, call your doctor's office. How do I care for my incisions? The location and size of your incisions will depend on the type of surgery you had. It is normal to have some numbness of the skin below the incisions. This sensation will lessen over time. Discuss the care of your incisions with your medical team prior to discharge. How can I prevent constipation? You may experience constipation, trouble passing stool, after your surgery. This is a common side effect of opioid pain medication. Gentle activity such as walking and drinking more water can help reduce this side effect. If having difficulty with constipation, please call your doctor's office. When can I resume normal activities? Doing your normal activities is an important part of regaining your strength. However, follow the guidelines below. Don't lift anything heavier than 10 pounds, strain, or do strenuous exercise for at least 6 weeks after your surgery, or as instructed by your surgeon. Walking is a good way to increase your endurance. You can climb stairs, but try to limit how often you do this for the first week you're home. Don't go out by yourself until you're sure of what you can do. Rest as needed. It is not uncommon for it to take several weeks to resume a normal sleep pattern. When is it safe for me to drive? Don't drive until your surgeon tells you it's okay. This will be some time after your first follow-up appointment after your surgery. If you're still taking your prescribed pain medication, your surgeon may want you to wait longer before driving. The pain medication can slow your reflexes and responses, making it unsafe to drive. What type of follow-up care will I receive after I leave the hospital? Your surgeon will want to see you for follow-up after surgery. If you don't have an appointment before you leave the hospital, call your surgeon's office to schedule it. It is important that you go to all your follow-up visits after surgery. You can call your doctor or nurse if you have any questions in between these appointments. Remember, your surgeon's instructions supersede any material discussed in this video. Thank you for trusting us with your healthcare needs. If you have any questions or concerns once you return home, please call your doctor's office. At CHI St. Vincent, our commitment to your well-being extends beyond the operating room. Our compassionate care continues after surgery. We're here to support you on your path to recovery and to help you regain your quality of life. Trust us to help guide you through a successful recovery.